A lot of Tom Price's commentary there centered on competition in the insurance marketplace. Do you acknowledge that that has not gone as was designed or well, that there is an issue of competition here? And does this legislation, do you think it would take any steps to correct that?
Well, I don't think so. I think there are a lot of reasons why insurers decide to enter certain markets and not enter other markets. And I'm not sure what this legislation does to encourage that. Clearly, under the Affordable Care Act, we had provisions to stabilize the insurance markets, to guard against some of the increases in premiums that some of the exchanges have seen as a result of sicker people coming into the market earlier. Congress has withheld those funds from going to insurers to prevent those bumps in premiums, and that certainly would do quite a bit, and I think would make a big difference.
Lanhee Chen, let me turn to you here. Over and over again, we heard the Secretary of Health and Human Services say this is about patience. Let me have a little bit of fun here with a homonym. It doesn't seem like Republicans are that patient to wait for a CBO score here. How fatal a mistake do you think that could be? We see the divisions within the Republican Party. Why not wait for the CBO to score this thing?
Well, I think obviously the CBO score, the CBO determination on cost and coverage is going to be important. But I think the philosophy here, frankly, is to get a piece of legislation out there so that we can have a discussion about actual pieces of reform. And I think that the challenge we had before the legislation came out is that no one was exactly sure what it is was going to compose the Republican plan. And so now at least there is a plan that can be discussed for good or for ill. And I do think that strategically that was an important thing to do.
I asked Jon Selib before Tom Price got started there during the daily press briefing about his reaction to the legislation itself. Based on what you worked on, what you were hoping for, how closely does that hew with what we're seeing from the Republicans?
I think there are a lot of elements here that make sense. Certainly on the repeal side, they have done as much of repeal as is practical through this budget reconciliation process. On the replace side, they've done a number of things that I think are good. Is it a perfect piece of legislation? No, clearly it's not. I think you're seeing conservative disagreement about that. But in my view, there are a lot of things that are to come as part of this negotiation. So as an opening bid, it's a pretty darn good start.
An opening bid here, something that Tom Price brought up, Jon Selib, is this notion that you'd be able to buy insurance across state lines, much in the way that you can cross the state line from Massachusetts to New Hampshire and buy liquor, I suppose. People know how to do that, might want to do it with health insurance care as well. How difficult is that, and why is that something that you think Republicans are caring so much about here?
I don't know why Republicans care about it so much, but I think that some of the challenges with that policy are, A, as I was mentioning, I think there are a whole host of reasons why insurance companies do want to provide coverage in a state and not provide coverage. There are a whole host of economic reasons for them to do so. I think one of the other challenges there is that in an unregulated insurance marketplace, which is what this legislation would move to, what you might have happen is all of the insurance companies domiciling in a state that has very few regulations and allows them to offer plans that don't provide very much in the way of consumer protections and coverage for individuals.
Lanhee Chen, I look at this piece of legislation. I see the preservation of, say, insurance benefits for those who are young, a bit younger than 26. How difficult is it going to be to maintain parts of the Affordable Care Act that people like? You look at polling people like, and still do the sort of wholesale changes that are being proposed in this legislation.
I think that is the major challenge here, that they're using a particular legislative process. This budget reconciliation process is arcane. Not all that many people, certainly not many Americans, have spent time really understanding it. And that restricts the ability, frankly, of Republicans to effectuate wholesale repeal on issues like insurance regulations. For example, the requirement that all plans cover the same set of what are known as essential health benefits. That is something that apparently through this process you can't repeal. The provision you've mentioned earlier regarding people under 26 being able to remain on their parents' plans, that is something else which, frankly, I don't think is repealable through this process. So they're going to have to keep sort of bits and pieces, and the question does become going forward, how much of the previous system will work with the new system they're trying to bring in behind it. I think they've done, as I said, the best they can to date and to this point. The question is whether the votes are there, both in the House and the Senate, to get this thing across the finish line.